Welcome to the Westgate Resorts Open Enrollment for the 2024-2025 plan year. Westgate Resorts is committed to offering quality plans and a well-rounded benefits package to their team members now and in the future. This year's open enrollment will start on Friday, May 3rd and will end on Thursday, May 16th, 2024. Open enrollment is your one chance each year to review your coverage options and make changes to your benefits. Your choices are in effect from June 2024 through May 2025 unless you have a qualifying life event. If you have any questions, please email them to benefits@wgresorts.com or contact your local team member services. Here is a highlight of what is changing for the 2024-2025 plan year. You should also have received an enrollment packet mailed to your home with these changes along with the premiums. As a reminder, please review all the benefits Westgate Resorts offers you and select the plans that work best for you and your family. You can learn more about your benefits by viewing this presentation or reviewing your benefit highlights and summary plan description. Make sure to complete your enrollment by 11:59 p.m. Eastern Time on May 16th. So let's get started. During this presentation, we will provide an overview of the benefits offered. We'll discuss our partner, Quantum Health, the wellness program requirements. We'll review in further detail the specific benefits offered and how to enroll online with PlanSource, and many more important reminders. Through Quantum Health, you have access to a dedicated team of claims experts, customer experience professionals, and nurses to help you anytime you have a benefit need. Call 833-762-0889 or visit mywestgatebenefits.com. Your Quantum Healthcare coordinators will answer claims, billing, and benefits questions, help you find in-network providers, verify coverage, and help you get prior approval if needed. Contact providers to coordinate your treatment, and more to help you save on out-of-pocket costs. Please know that Quantum may contact you, but only if it's important. Download the Quantum Health app to connect with a care coordinator, access your ID card, search for in-network providers, and more. This is available from the App Store or Google Play. Just search MyQHealth or scan the QR code shown here. Here's another view when accessing the mywestgatebenefits.com member website. Again, the MyQHealth app offers the same functionality as the website. Here is a comprehensive list of the benefits offered to Westgate Resort team members. You are eligible for benefits as a full-time team member working at least 30 hours per week. You may also cover your eligible dependents, including your spouse and any children up to age 26, when you elect coverage for yourself. Outside of your new higher enrollment and open enrollment periods, the only time you can make changes to your benefits is if you experience a qualifying life event. Any members wishing to add new dependents to coverage will be required to submit appropriate documentation into the My Documents section of PlanSource within 30 days of insurance effective date. Coverage will not start until documentation is submitted and approved. Premium changes will take place after documentation is approved, and any missed charges back to the original start date will be added to the next paycheck. Childbirth is the exception. The qualifying event date must be the date of birth. Acceptable forms of dependent documentation include a marriage certificate or birth certificate. Upon completing your enrollment in any benefits requiring dependent verification, you will receive an alert stating your benefits are pending approval. You will see a to-do list, which will indicate which documents are being requested. For any additional questions, please email benefits@wgresorts.com. Your Westgate Voluntary Wellness Program journey starts here. Westgate Wellness is committed to helping you achieve your best health. Our voluntary wellness program provides personalized awareness, education, and coaching to all participants, team members, and covered spouses on our group medical plans. We also offer lower premiums and cash incentives for team members and their covered spouses for managing their health. To participate in Westgate Wellness, team members and their covered spouses must do or have done the following: take the clinical health risk assessment by the due date, complete the biometric screenings by the deadline, take and pass the cottonine test during the biometric screening, be tobacco or nicotine free for at least 6 months. Team members who are moderate or high risk will be invited to a coaching program as outlined under Coaching. Westgate Resorts provides wellness participation incentives as shown in the chart. Earn cash by achieving biometric screening targets including BMI, blood pressure, LDL and HDL cholesterol, fasting blood sugar, and triglycerides, and for getting an annual physical exam. The biometric incentives are based on the results of your completed biometric screening. Incentives are available for the team member and the covered spouse. If you think that you might be unable to meet a standard for a reward under this wellness program, you might qualify for an opportunity to earn the same reward by different means. Contact UMR at 800-207-7680 or HealthSCOPE members 844-604-6245 to engage with a health coach, and they will work with you, and if you wish, your doctor, to find a wellness program with the same reward that is right for you in light of your health status. Cash incentives will be processed through payroll on a semi-annual basis listed here. If you elect medical coverage, you will be asked to complete the tobacco affidavit question during your online enrollment each year. So what exactly is a health savings account? An HSA is a special type of bank account designed to help you save and pay for qualified medical expenses. In simple terms, it's like an IRA for your health. But with an HSA, you don't have to wait for retirement to spend the money. You can use it this year, next year, or years from now. An HSA works like this. First, you open an account and deposit money into it, income tax free. The funds in the HSA belong to you. You own the account from the day you open it. There's no use it or lose it rule like there is with flexible spending accounts or FSAs. The account is with you as long as you want it to be, even if you change jobs, lose your job, or choose a different health plan. You save on taxes. The money you put into an HSA is tax deductible. You don't pay federal income tax on HSA contributions or state taxes in most states. And any money you take out to pay for qualified medical expenses is income tax-free too. You can use your HSA to pay for qualified healthcare expenses for you and your family now and in the future. This slide gives you an example of the savings you may have when you contribute to an HSA. What you contribute affects the amount of savings you will see. You own the HSA account, and the contributions made this year can be used next year or years from now. You don't ever lose your HSA contributions. The health savings account plan can be broken down into two parts: the high deductible medical insurance and the savings account. The high deductible insurance will act as any of the medical insurance plans would, protecting you from medical bills through preventative services, deductibles, co-insurance, and out-of-pocket maximums. The savings account will allow you to pay for your deductible and any other eligible expenses with pre-tax dollars deducted from your paycheck. It will also serve as a tax-deferred savings account. You are offered 3 healthcare accounts: a health savings account or HSA, an FSA medical spending account, and a dependent care account. Your choice between the medical insurance options drives your eligibility for each account. To be eligible for the HSA, you must be enrolled in the minimum HDHP plan. To be eligible for FSA or dependent care FSA, you do not need to be enrolled in a medical plan. Minimum plan participants with an HSA cannot enroll in the FSA. For all 3 plans, the funds can be used towards eligible healthcare expenses. A more expansive list of these expenses can be found in the PlanSource document library or the IRS website. With the HSA, your funds will roll over year to year. With the FSA and DCFSA, any unused funds will be forfeited after the grace period. Please take a moment to fully review the chart to evaluate which account best fits your needs. You can access your HSA balance by logging into the UMR site or mywestgatebenefits.com. Select the Account Balances tab, then view your HSA balance information. It also features a link to Optum Bank for full account capabilities that allow you to pay bills, make deposits, manage your investments, and view your transaction history. With a medical FSA, you are able to contribute up to $3,200 annually to pay for medical, dental, and vision expenses with pre-tax dollars. With the dependent care FSA this year, you can contribute up to $5,000 annually to pay for dependent care services and expenses with pre-tax dollars. This benefit is offered to full-time team members who have satisfied 1 year of employment and is effective in June of each year. So how much should you contribute? Add up all of the out-of-pocket expenses you had last year. This includes copays, deductibles, coinsurance, prescriptions, dental, vision, any child or elder care, and voluntary health policies not payroll deducted. The dependent care expenses provided during a calendar year cannot exceed $5,000 a year for individuals or married couples filing jointly. Please remember that FSA funds will not roll over to the next plan year, so be conservative in making your election for the 2024-25 plan year. Any unused funds left in your healthcare or dependent care FSA at the close of your grace period, which is August 15th, 2025, are not refundable to you. The grace period means that you are given an additional 2.5 months to incur new expenses with prior year plan funds. At the end of the grace period, all unspent funds must be forfeited according to the IRS. You will have 90 days after the plan year ends to submit dependent care claims that were incurred during the prior plan year. Here are some examples of eligible and ineligible expenses for healthcare under the FSA. Here are some examples of eligible and ineligible expenses for dependent care. New enrollees will receive a TASC debit card, which will be mailed to your home address. All current enrollees should also expect to receive a new card in May of 2024. It acts as a debit card and will come preloaded with the amount of your annual contribution for the healthcare FSA. The task card will also work for your dependent care FSA, but only with the available account balance. This will provide direct payment while at your provider when swiped from your FSA based on the balance on the card. You can request one additional card for a dependent or spouse at no charge. Your task card is good for 4 years, so hang on to it. The MyTask mobile app provides you with real-time account balances. You can request a reimbursement. You can submit receipts using your device camera. You can view plan information, contributions, and transactions. With MyTask text messaging, You can request your account balance or a reimbursement. Here is a comparison of all UMR and HealthSCOPE medical plan options. The minimum, base, HPP, and PPO plans provide access to healthcare facilities and providers in the UMR Choice Network. The HealthSCOPE HSP plan provides access to facilities and providers in the Imagine Health Network. When electing any of these plans, be aware of the individual and family deductibles for each plan, which will need to be met prior to UMR or HealthSCOPE paying any portion of your eligible services, unless that service has a listed copay. After you have met your deductible, you will then be responsible for your coinsurance and any copays up to your total out-of-pocket maximum. Once you have met your total out-of-pocket maximum, UMR or HealthSCOPE will pay eligible charges at 100%. All medical plans offer preventative care coverage at 100%. Preventative care services are such things as annual physicals, well woman annual exams, mammograms, immunizations, colorectal cancer screenings, and well child care. All plans have access to Teladoc virtual visits, and all plans except the minimum plan will pay a $10 copay at the time of the call for general medicine. Members on all medical plans using specialty medications will go through the Maxer Plus specialty pharmacy program. Specialty medications are those that may require ongoing clinical oversight and education for best management. They may have a unique storage or shipping requirement and may not be available at retail pharmacies. This program provides the resources and personalized, condition-specific support that's needed to help better manage your condition. New ID cards will be issued to team members electing a new UMR medical plan or team members enrolled in the UMR Minimum HDHP medical plan. Your ID card will be mailed to your home. You'll notice Quantum Health, HealthSCOPE, Imagine Health, and Maxer on your ID card. If you are currently enrolled in the UMR base medical plan, the UMR HPP medical plan, or the UMR PPO medical plan, you will continue to use the same card for the 2024-2025 plan year. New ID cards will be issued to team members electing HealthSCOPE medical plans for the first time. Your ID card will be mailed to your home. You'll notice Quantum Health, HealthSCOPE, Imagine Health, and Maxer on your ID card. If you are currently enrolled in the HealthSCOPE medical plan, you will continue to use the same card for the 2024-2025 plan year. This slide shows the medical biweekly rates for team members and their family. This slide shows the medical weekly rates for team members and their family. Choosing the right healthcare setting for your illness or injury can save you on out-of-pocket expenses. This table shows you the estimated cost of medical service for each Westgate medical plan to help you determine which is best for you. Be familiar with the options you have prior to needing services. Remember, you can use Quantum Care Coordinators Monday through Friday to get help choosing the right healthcare setting for illness or injury. As a member, you and your family will receive access to U.S. board-certified physicians who can consult, diagnose, and prescribe medication if deemed appropriate via interactive audio or video. Regardless of the time and location, you can connect with a physician for common and acute illnesses. The physician will be able to review your telemedicine record, discuss symptoms, and treatment options. Some of the benefits of Teladoc include 24/7 365 access to a physician. You can speak to a doctor at work, while you're traveling, or from the comfort of your own home. You can save money by avoiding expensive ER and urgent care visits. Here are some tips to save money on emergency care. Emergency rooms are for serious conditions. Instead of going to the ER next time, Take a few moments to consider an urgent care facility or a retail walk-in clinic, which may be located inside your pharmacy. It will save you time and money. Take time now to find an urgent care facility in your area so you will know where to go the next time you need care. Team members enrolled in a UMR medical or HealthSCOPE HSP medical plan will have access to the Walmart Health Centers. Refer to the center location to find the one nearest to you. Imagine Health is partnered with Orlando Health. Be sure to visit www.mywestgatebenefits.com to find an Imagine Health provider and receive the highest level of benefits with the HSP plan. If you currently see an Orlando Health provider, please be sure they know you are covered under a new plan. The HSP plan covers medical services for physicians and hospital facilities. You decide at the time of service whether you want to receive the best coverage under this plan. Then you will want to make sure you are seeing an Imagine Health provider. Your responsibility will be a lower cost share for the Imagine Health network of copays and deductibles shown on the summary, and you will not owe your provider anything more than what is shown. There is no balance billing for the service. However, if you decide to select any facility or provider, you will owe whatever deductible, coinsurance, or copays are due based on the non-Imagine network plan schedule for that particular service, and the price is based on a percentage of Medicare. You could owe more or be balance billed. Some roadblocks you may encounter with the HealthSCOPE plan include service refusal at the provider's office and receiving a balance bill. If you experience any issues, follow the instructions on this page and remember, you have an advocate. Call Quantum Healthcare Coordinators at 833-762-0889 if you run into any roadblocks. With TalkSpace Online Therapy, you can message a licensed therapist 24/7 safely and securely from your phone or desktop. No office visit required. Simply register and choose a provider and message anywhere, anytime at Talkspace.com/connect. TalkSpace is your space to use in your time. It's covered under your plan's behavioral health benefits. The EAP is available to team members and members of their households. You do not have to be enrolled in any of the benefit plans to take advantage of the EAP. EAP provides a variety of services that will support your work-life balance, including referrals and information for family care, including, but not limited to, child, elder, and special needs care. 6 free face-to-face licensed counseling sessions, and an online education and resource center to find information on topics ranging from healthy meal planning to parenting to getting organized and setting goals. The Resilient Mind and Body program is available to all team members and can be applied immediately to your workday and provide education, motivation, and accountability. It's a 12-week program that progresses through practical mental and physical knowledge, skills, and tools for optimal well-being. You are not required to complete all 12 weeks. Simply choose the topic or topics that interest you. Watch and repeat as often as you like. Share this program with your family. Westgate Resorts is excited to introduce Virta Health. Virta is a virtual clinic that helps members eat their way to better health with care plans made just for them and support from healthcare clinicians, coaches, and digital health tools. Virta members can reverse type 2 diabetes, prediabetes, high blood sugar, and weight gain. Less or no meds needed, no required gym visits, and no calorie counting. Virta is available at no cost to eligible members and dependents. To get started, visit www.virtahealth.com/join or use the QR code. Real Appeal is a comprehensive online weight loss program available at no cost to eligible Westgate Resorts team members and families enrolled in UMR medical plans. Get started by enrolling at www.mywestgatebenefits.com or MyQ Health app from your smartphone, tablet, or personal computer. With Virta Health and Real Appeal both being offered by Westgate, you may want to know the difference between the obesity and pre-diabetes programs. Both programs have different BMI requirements for eligibility and different approaches with coaching. Review this slide to learn more about each program to determine which is best for you. Maxer Plus is your pharmacy benefit manager. Call Quantum Health at 833-762-0889 to speak to a care coordinator, or go to www.mywestgatebenefits.com to find the Maxer Plus link. You can also text Maxer to 50589 or scan the QR code. To help manage the rising prescription costs, we have added a voluntary program for certain brand name maintenance medications. The program's name is WG Meds, offered through Canna RX, an international pharmacy program. Advantages of joining WG Meds are $0 copay for all brand name prescriptions offered through the program, so no out-of-pocket expense. Prescriptions shipped directly to your home with no shipping and handling costs. Review the enrollment form, which includes the list of brand name maintenance medications. And by getting your prescription through WG Meds, you will have $0 copay and receive a $50 gift card for your first prescription fill. This program is available for participants in the base, HPP, PPO, and HSP plans only. This does not replace your prescription coverage with UMR. Visit the website shown here for further details. Please familiarize yourself with these prescription-saving tips. You may still go to your local pharmacy when accessing Manifest. This does not replace your pharmacy benefit. Team members and their families enrolled in UMR or HealthSCOPE plans should take advantage of Costco. You do not need to be a member. You simply show your UMR ID card and will pay no copay for generic medications, $20 for preferred brands, and $40 for non-preferred. Westgate Resorts offers a prescription drug plan program through Paid Health. This plan provides additional support to members prescribed specialty drugs and products. Prior authorization and participation is required of those members prescribed specialty medication within the program. Are you Medicare eligible? Asking yourself these questions may help you determine your eligibility. As a reminder, you can enroll any time of the year, once you or your spouse are eligible for Medicare, regardless of your group benefit plan election options. Transitions Benefit Group is thrilled to have the opportunity to collaborate with you and your loved ones. Their dedicated team is here to provide comprehensive assistance in a wide range of areas, including Medicare coordination, Social Security planning, healthcare plan options, and more. Don't hesitate to reach out whenever you need support with any of your needs. Please visit transitionsrbg.com or call 800-936-1405 to schedule a consultation with an advisor today. It is important to understand what Medicare is. Medicare is the federal health insurance program for people 65 years or older, certain individuals under 65 with disability, or any age diagnosed with end-stage renal disease. Medicare comes with several different coverage options, as shown on this chart, Part A, B, C, D, and GAP plans. Additionally, Medicare offers supplemental medical plan options. This additional coverage is offered by private insurers to help people pay for a portion of healthcare costs not covered by original Medicare, even deductibles and coinsurance payments. It is best to schedule a call with a transitions advisor to help walk you through the options. Here is a side-by-side comparison of the DHMO versus the DPO for your reference. This is also located in the Benefits Highlights booklet. Westgate Resorts offers 2 dental plans with Delta Dental. The DHMO has no deductibles, coinsurance, annual or lifetime limits. It includes 1 cleaning per 6-month period. The plan has a schedule of benefits with predetermined copays. Out-of-pocket costs are very clearly defined. You must receive care from a Delta Care dentist, in-network only. Orthodontic coverage is available for children and adults. You must select a dentist during online enrollment. If you wish to change at any time, call customer service. The PPO plan is available nationwide. It has in and out-of-network benefits, but staying in-network is the best value. Deductibles, coinsurance, and annual limits apply. It includes 2 cleanings in a 12-month period. You are able to stay with your current dentist even if not participating and still receive benefits out of network. Orthodontic coverage is available for dependent children to age 19 only. Dental implants are covered. There is a diagnostic and preventative max waiver. Diagnostic and preventative dental services will not count towards your annual maximum. Within the dental PPO or DPO plan, there are 2 different networks to choose from, in-network or you can go out-of-network. In-network dentists have a contract with Delta, which provides reduced fees to members. There is no balance billing and no claim forms. See the bullets in the first box. Delta also offers a unique secondary in-network group of providers, which is the Delta Premier Network. This network is larger than the dental PPO. 80% of dentists nationwide participate in this network. Please refer to the bullets in the second box. Or, members can visit out-of-network dentists, but they will be responsible for any fees beyond reasonable and customary charges and could be asked to pay the entire fee at the time of service. See the bullets in the third box. When viewing the online directory, you can specifically select the system to pull a list of PPO or Premier dentists, so you are able to see all the options. For your reference, here are the bi-weekly and weekly team member contributions. The premiums for dental have stayed the same this year. The vision benefit gives you the freedom to select either an in or out-of-network provider and still have coverage, although going in-network is recommended to receive the most from this coverage. Benefits are on a rolling 12-month period, meaning you must wait a minimum of 12 months before you can submit a claim for the same materials or service. Your benefit allowances do not reset on the plan year or calendar year anniversary. You may receive 1 eye exam and 1 pair of prescription glasses or contacts every 12 months. The plan has copays and a maximum allowance for frames and contact lenses. This plan offers a select set of eye care services for members diagnosed with type 1 diabetes for an additional $20 copay. VSP's vision plan is to assist you with vision care expenses by providing both an eye examination and materials, lenses and frames, or contact lenses. VSP Vision Plan Network is called Choice. VSP is affiliated with Costco Optical, Eye Care Centers of America, and other high-quality retail chains. To find a VSP doctor or retail chain affiliate, visit vsp.com or call 800-877-7195. For your reference, here are the biweekly and weekly team member contributions. Westgate Resorts covers the cost of basic life and accidental death and dismemberment for both full-time hourly and salaried team members. Full-time team members will be automatically enrolled in the appropriate coverage level. You are required to designate a beneficiary online through PlanSource. This can be changed at any time. Voluntary employee life coverage is available in $10,000 increments, up to the lesser of $500,000 or 7 times your annual earnings. This year, during open enrollment, an increase up to $30,000 annually for employee voluntary life will be allowed without an EOI. This is a great opportunity to increase your coverage without needing to complete an EOI. Spouse voluntary life coverage is available in $5,000 increments up to the lesser of 50% of the employee selected coverage up to $250,000. Child voluntary life coverage is available in 2 options, $5,000 or $10,000 amounts, regardless of the number of children. An employee must have selected at least $10,000. Life and AD&D coverage is offered together. Evidence of insurability, EOI, is required for new elections outside of initial new hire eligibility. Voluntary short-term disability plan replaces 60% of your pre-disability base salary up to a maximum weekly benefit of $2,000 should you become sick or experience a non-work-related injury. Benefits begin on the 15th day of accident or illness. Maternity coverage is included. Benefits can continue up to a maximum of 24 weeks. Keep in mind, there is a 3-month look-back period from the time you elect coverage. That means, for example, if you are currently being treated for a medical condition and you choose short-term disability during this OE, this condition will not be covered for 6 months. Evidence of insurability is not required during open enrollment for new elections, but is required at any other time. Long-term disability protects your loss of pay when you are sick or injured and unable to work, non-job related. You are automatically enrolled if you are enrolled in one of the medical plans through Westgate. Your benefit is equivalent to 60% of before-tax monthly earnings, not to exceed $10,000 monthly. There is a 3-month look-back, which means if you have been treated for any medical condition 3 months prior to coverage, that medical condition will not be covered for 12 months. This would not apply if you have elected voluntary STD. There will be a 180-day elimination or waiting period before receiving this benefit. The transition from voluntary, short-term to long-term disability benefits will be coordinated through Mutual of Omaha and your doctor's office. Additional resources from Mutual of Omaha include will preparation services, hearing discount programs, and worldwide travel assistance with identity theft protection. The voluntary accident insurance plan offered from Voya. The purpose of this policy is to cover on and off the job accidents and injuries. There is a listing of specific injuries and accidents that are covered and what the benefit amount will be for that specific injury or accident. The accident insurance pays directly to you regardless of other insurance that you may have, such as medical, auto, or short-term disability. Also, you do not need to be enrolled in UMR's medical plan. It is available to you and your family. The wellness benefit encourages wellness-related tests and rewards to these team members. Important to note is that the wellness rider that is part of this plan, which will pay directly to you $150 when certain wellness-related tests are performed. What this means is that you and your covered spouse can receive a benefit of $150 for certain wellness-related tests. For example, when you have routine physicals, mammograms, or colonoscopy, among other tests that are listed in the accident insurance brochure, You and your covered spouse can each receive the $150 benefit. No evidence of insurability if you're electing past your initial eligibility. The benefit resets each calendar year. The wellness benefit encourages wellness-related tests and rewards those employees that take the time to get those tests done. You will receive a packet of information once enrolled that will explain how to file a claim. Here is the schedule of benefits for specific fractures and dislocations, and the flat dollar amount Voya will pay to you after an accident. Open reduction means that the wound requires surgery. Closed reductions means the wound does not require surgery. The voluntary critical illness plan from Voya pays a lump sum benefit if you are diagnosed with a covered illness or condition. Critical illness insurance is a limited benefit policy. It is not health insurance. Features of critical illness insurance include no medical questions or tests required for coverage. It is a guaranteed issue. You can use the benefit money for any purpose you like. Premiums are paid through convenient payroll deductions. This plan also pays out an annual wellness benefit if you complete a health screening test. You may only receive a benefit once per year, even if you complete multiple health screening tests. Examples of health screening tests are Pap test, serum cholesterol test for HDL and LDL levels, mammography, colonoscopy, dental exams, and stress test on bicycle or treadmills. The annual benefit is $75 for completing a health screening test. This applies to team members, their spouses, and children. Critical illness insurance can help you when you are diagnosed with one of the covered illnesses or conditions listed here. Some examples would be medical expenses, such as deductibles and copays, childcare, home healthcare costs, mortgage payments, rent, and home maintenance. Here is an example of tobacco user and non-tobacco user monthly rates per $1,000 of coverage. Premiums are based on your age and tobacco status and can be viewed when enrolling online in PlanSource. Here are some examples of monthly age-banded premiums for coverage. Further details are included in the benefit highlights and summary plan description and in the PlanSource library. The voluntary hospital indemnity plan from Voya can help you pay any expenses for a hospital stay that are not covered by your medical insurance, such as your deductible or coinsurance. You can choose from 2 plans with different coverage levels to best meet your needs. Features of Hospital Indemnity High Plan include no pre-existing condition limitations and no age reduction. You can use the benefit money as you see fit. For example, to help pay your copay, deductibles, and coinsurance costs due to hospitalization or lost time from work. Premiums are paid through convenient payroll deduction. This plan also pays out an annual wellness benefit if you complete a health screening test. You may only receive a benefit once per year, even if you complete multiple health screening tests. Examples of health screening tests are Pap test, serum cholesterol test for HDL and LDL, mammography, colonoscopy, and a stress test on bicycle or treadmill. The annual benefit is $75 for completing a health screening test. This applies to team members, their spouses, and children. Features of the Hospital Indemnity Low Plan include no pre-existing condition limitations and no age reduction. You can use the benefit money as you see fit, for example, to help pay copay, deductibles, and coinsurance costs due to hospitalization or lost time from work. Premiums are paid through convenient payroll deductions. There is no annual wellness benefit for the Hospital Indemnity Low Plan. With the ASBC Pet Health Insurance Program, you can choose the care you want when your pet is hurt or sick and take comfort in knowing they have coverage. ASBCA offers customizable options for pet owners. Visit aspcapetinsurance.com/WGPets and be sure to use the Westgate priority code for additional discounts. You and your dependents have access to legal assistance for some of the most frequently needed personal legal matters, with no waiting periods, no deductibles, and no claim forms when using a network attorney for a covered matter. You can choose one from our network of pre-qualified attorneys or use an attorney outside of our network, realizing you will be reimbursed some of the cost. It's easy to access MetLife Legal. You can access MetLife Legal plans by calling 800-821-6400 or by visiting the website at members.legalplans.com, and a client service representative will help you find a network attorney in your area. Or if you have a quick question for an attorney, employees can send questions directly to our attorney e-panel and get a response within 48 hours. As a reminder, online enrollment is done through PlanSource. To log in, visit benefits.plansource.com. All passwords have been reset for open enrollment. Once you are ready to enroll, click on Get Started to review your and your dependents' information and begin shopping for benefits. Within PlanSource is a document section that stores important benefit docs, life event information, as well as required notices. You will be shown the details for your eligible benefits. Premiums will be shown as a per-pay deduction cost to you. You must select or decline all coverages before moving on. When finished, click on the Review and Checkout button at the bottom of the page. As a reminder, if you wish to add, drop, or change coverage, you must do so by going online no later than Thursday at 11:59 p.m. on May 16th, 2024. Go online to review all data: name, address, dependents, dates of birth, Social Security number, and current plan elections. Review further detailed benefit summaries and new deductions that apply to you. Determine if you need to make changes. All changes must be updated in ADP. If you are covering a spouse, you will need to log into PlanSource to answer the spousal surcharge question about your spouse's alternative medical insurance coverage, even if you answered this question last year and nothing has changed. It is critical to ensure that your beneficiaries are always up to date for life, accident, critical illness, and 401k plans. This concludes the presentation for open enrollment. Any questions can be emailed to benefits@wgresorts.com. Thank you for your time.